Welcome to the Presidential Claim Record. This opening slide reflects a percentage-based breakdown of direct quotes from President Donald J. Trump, reviewed from April 1st, 2026 through April 23rd, 2026, classified across 4 categories: false, unsupported, misleading, and supported. Now let's move to the scorecard. The left side of the scorecard reflects cumulative results from April 1st, 2026 through April 22nd, 2026, broken down by category. We now turn to the results from April 23rd, 2026. As for false, 2 claims were identified. On April 23rd, 2026, during the White House Healthcare Affordability event, regarding the projected impact of the prescription drug pricing announcement, President Trump stated, "This will result in the largest drop in prescription drug prices in the history of the United States." This claim is false. Available evidence does not confirm that the announced policy has produced the largest prescription drug price reduction in United States history, and the claim presents a record-setting result before such an outcome has been measured. On April 23rd, 2026, during the same event, regarding the size of negotiated drug price discounts, President Trump stated, "We've secured gigantic discounts, even 4, 5, and 600%. This claim is false. A price discount above 100% is not possible under standard pricing math. A 100% discount reduces the price to 0, so discounts of 400, 500, or 600% cannot describe a conventional price reduction." As for unsupported, 39 claims were identified. On April 23rd, 2026, during the White House Healthcare Affordability event, regarding the stock performance of pharmaceutical companies following the prescription drug pricing announcement, President Trump stated, "Many of their stocks are up." This claim is unsupported. At the time of review, there is no verifiable, time-specific market data demonstrating that pharmaceutical company stock prices increased as a direct result of the announcement. On April 23rd, 2026, during the same event, regarding pharmaceutical company participation in the pricing announcement, President Trump stated, 17 of the world's largest pharmaceutical companies, representing 80% of the branded drug market, have agreed to sell their drugs at the lowest price anywhere in the world." This claim is unsupported. Available reporting supports a major pricing framework, but the full company list, market share calculation, and enforceable global lowest price terms were not independently confirmed in the record reviewed. On April 23rd, 2026, during the same event, regarding negotiations with foreign countries over drug pricing, President Trump stated, "I said, if you're not going to agree to it, we will put tariffs on your country. And they said, we will be honored to do it. They agreed to do it." This claim is unsupported. Available reporting confirms tariff relief was part of some drug pricing discussions, but it does not independently verify that foreign countries agreed to pricing terms because of tariff pressure. On April 23rd, 2026, during the same event, regarding U.S. population share, prescription drug use, and pharmaceutical profits, President Trump stated, "The United States is 4% of the world's population and only 13% of all prescription drugs. Yet pharmaceutical companies have been making 75% of profits. This claim is unsupported. Available evidence supports that the U.S. pays substantially more for many prescription drugs, but the exact combined statistic is not verified by an authoritative public dataset. On April 23, 2026, during the same event, regarding new drugs under the pricing framework, President Trump stated, "Committing to offer all new drugs moving forward at most favored nations prices." This claim is unsupported. Available reporting supports MFN-related commitments, but does not verify universal implementation for all new drugs moving forward. On April 23, 2026, during the same event, regarding Medicaid pricing, President Trump stated, "They will make their current drugs available to Medicaid at MFN." This claim is unsupported. Available reporting supports Medicaid price reductions connected to the announcement, but does not verify full implementation terms across all current drugs. On April 23, 2026, during the same event, regarding pharmaceutical manufacturing investment, President Trump stated, "The company will invest to build up research in pharmaceutical manufacturing here in America." This claim is unsupported. The available record does not verify the investment amount, facility plan, timeline, or scope. On April 23, 2026, during the same event, regarding the medical status of the child discussed during the event, President Trump stated, "This is 100%, the 100% death." This claim is unsupported. Available reporting confirms the child was treated for genetic hearing loss, but the exact statement that he was 100% deaf is not independently verified by medical documentation in the record. On April 23, 2026, during the same event regarding the child's hearing outcome after treatment, President Trump stated, "He doesn't hear perfectly, but he actually does. It's about 1% off." This claim is unsupported. Available reporting describes hearing improvement, but does not verify the specific measurement that the child's hearing was only about 1% off. On April 23, 2026, during the same event regarding a weight loss drug pricing example, President Trump stated, "One of the most popular weight loss drugs that's gone from $1,350 a month to as low as $199 a month." This claim is unsupported. Available evidence does not verify this exact pricing claim without the specific drug, payer status, eligibility rules, and whether the figure reflects list price, negotiated price, or patient out-of-pocket cost. On April 23, 2026, during the same event, regarding the same weight loss drug and an international price comparison, President Trump stated, "It used to sell in London for $89, and they raised it to $199. This claim is unsupported. Available evidence does not verify the exact London price comparison, the drug identity, or whether the prices are comparable under the same pricing structure. On April 23, 2026, during the same event regarding long-term prescription drug pricing in the United States, President Trump stated, "Our country has been being ripped off for 30 years, 30 or 40 years. This claim is unsupported. Available evidence supports that U.S. prices have long been higher than peer countries for many drugs, but the 30 to 40-year framing is not verified by a specific authoritative historical data set." On April 23, 2026, during the same event regarding IVF drug costs, President Trump stated, "We cut the cycle cost of IVF drugs by thousands of dollars." This claim is unsupported. Available evidence does not verify the specific cost reduction, affected drugs, responsible program, eligible patients, or time frame. On April 23, 2026, during the same event regarding COPD medication pricing, President Trump stated, "Reduce the COPD medications from $458 to $50. This claim is unsupported. Available evidence does not verify the specific medication, price type, patient eligibility, or effective date for this reduction. On April 23, 2026, during the same event regarding TrumpRX website traffic, President Trump stated, "TrumpRX has already received 15 million visitors." This claim is unsupported. The figure appears in event remarks, but available independent evidence does not verify the website analytics total. On April 23, 2026, during the same event regarding TrumpRX website performance, President Trump stated, "It's setting a record." This claim is unsupported. Available evidence does not define or verify the record being claimed. On April 23, 2026, during the same event regarding medical marijuana as a treatment option, President Trump stated, "It seems to be the best answer." This claim is unsupported. Available medical evidence does not establish medical marijuana as the best answer across the broad range of conditions implied by the statement. On April 23, 2026, during the same event regarding an individual's experience with medical marijuana, President Trump stated, "He lives a much better life now." This claim is unsupported. The statement describes an individual outcome, but available evidence does not independently document the medical basis or degree of improvement. On April 23, 2026, during the same event regarding pharmaceutical company participation, President Trump stated, "We have all the companies." This claim is unsupported. Available evidence confirms participation by a group of companies, but does not verify that all pharmaceutical companies are included. On April 23, 2026, during the same event regarding pharmaceutical company attendance at the White House, President Trump stated, "We had all of them here, the biggest companies in the world." This claim is unsupported. Available evidence does not verify that all of the biggest pharmaceutical companies were present. On April 23, 2026, during the same event regarding pharmaceutical company operations in the United States, President Trump stated, "I think by the time I leave office, they will be mostly operating." This claim is unsupported. The statement is forward-looking, and available evidence does not verify that outcome at the time of review. On April 23, 2026, during the same event regarding investment claimed to be coming into the United States, President Trump stated, "There's been $18 trillion. This claim is unsupported. Available public evidence does not verify the figure, source, time frame, or categories included in the $18 trillion claim. On April 23, 2026, during the same event regarding investment under the prior administration, President Trump stated, "The last administration had less than $1 trillion in 4 years." This claim is unsupported. Available evidence does not verify the comparison as stated because the investment category and methodology are not established. On April 23, 2026, during the same event regarding physical conditions around the White House grounds, President Trump stated, "The whole White House has been in bad shape." This claim is unsupported. Available evidence does not verify a documented condition assessment matching this broad claim. On April 23, 2026, during the same event, regarding prior bids for the Lincoln Memorial Reflecting Pool project, President Trump stated, "They had bids from the Biden administration. They had bids for years." This claim is unsupported. Available public procurement evidence reviewed does not verify the existence, timing, or source of the bids as stated. On April 23, 2026, during the same event, regarding prior estimated cost and timing for the Lincoln Memorial Reflecting Pool project, President Trump stated, "It was going to cost $300 million, and it was going to take maybe more than 3 years." This claim is unsupported. Available evidence does not verify the prior $300 million estimate or the more than 3-year timeline. On April 23, 2026, during the same event, regarding the Lincoln Memorial Reflecting Pool repair work, President Trump stated, "We then grouted all of the granite, fixed it up, took about 2 weeks." This claim is unsupported. Available public project documentation does not verify the work sequence or 2-week timeline. On April 23, 2026, during the same event, regarding durability of the Lincoln Memorial Reflecting Pool coating, President Trump stated, "It'll last for 40 or 50 years." This claim is unsupported. Available evidence does not verify a product specification, warranty, or engineering assessment supporting the 40 to 50-year durability claim. On April 23, 2026, during the same event, regarding the Lincoln Memorial Reflecting Pool after repairs, President Trump stated, "There'll be no leaks. There'll be no anything." This claim is unsupported. Available evidence does not verify a defect-free future performance guarantee. On April 23, 2026, during the same event, regarding Iran's military, President Trump stated, "The military is totally defeated." This claim is unsupported. Available independent reporting does not verify that Iran's military was totally defeated. On April 23, 2026, during the same event, regarding Iran's economic activity under the reported blockade, President Trump stated, "They are getting no business, and they are not doing well. Economically, financially, they are not doing any business because of the blockade." This claim is unsupported. Available evidence does not verify a complete halt in Iranian business activity. On April 23, 2026, during the same event, regarding the reported blockade against Iran, President Trump stated, "We have a blockade that's 100% effective." This claim is unsupported. Available evidence does not verify complete blockade effectiveness. On April 23, 2026, during the same event, regarding Iran's oil infrastructure under pressure from the reported blockade, President Trump stated, "Their whole oil infrastructure is going to explode." This claim is unsupported. Available evidence does not verify that this outcome was imminent or technically supported. On April 23, 2026, during the same event, regarding recovery from possible damage or disruption to Iran's oil infrastructure, President Trump stated, "You can recover 40, 50, 60%, but they have a matter of days until that takes place." This claim is unsupported. Available evidence does not verify the technical basis for the recovery percentages or timing. On April 23, 2026, on Truth Social, regarding CBD usage, President Trump stated, 1 in 5 adults used it in the past year. This claim is unsupported. Available evidence reviewed does not verify the claim against a cited national data set tied to the statement. On April 23, 2026, on Truth Social, regarding CBD outcomes, President Trump stated, "Many say it improved their chronic pain enormously." This claim is unsupported. Available evidence reviewed does not verify the claim through clinical data establishing the broad outcome as stated. On April 23, 2026, on Truth Social, regarding Dr. Mehmet Oz and hemp-derived CBD policy implementation, President Trump stated, Dr. Mehmet Oz has already launched a model for some seniors earlier this month. This claim is unsupported. Available public evidence verifies the December executive order, but does not verify the specific Oz model launch, timing, or scope. On April 23, 2026, on Truth Social, regarding a ceasefire between Israel and Lebanon, President Trump stated, "The ceasefire between Israel and Lebanon will be extended by 3 weeks." This claim is unsupported. Secondary reports reflect Trump's announcement, but available evidence does not include independent confirmation from Israeli, Lebanese, or other official diplomatic sources verifying that the 3-week extension was formally agreed to or implemented. On April 23, 2026, on Truth Social, regarding Los Angeles fire recovery and insurance company conduct, President Trump stated, "That aspect of this disaster has proceeded well. Big progress has been made." This claim is unsupported. Available evidence does not verify the level of disaster recovery progress or insurance company performance implied by the statement. As for misleading, 17 claims were identified. On April 23, 2026, during the White House Healthcare Affordability event, regarding drug pricing comparisons between the United States and other countries, President Trump stated, "Americans have been forced to pay the highest prices in the world." This claim is misleading. Available OECD and RAND data support that U.S. drug prices are substantially higher than peer countries, but the statement is absolute and does not account for variation across drugs, payers, and generic versus brand name markets. On April 23, 2026, during the same event, regarding U.S. prices compared with other countries, President Trump stated, "Prices that were many times what the rest of the world has spent." This claim is misleading. Available RAND research supports that U.S. prices are multiple times higher than comparison countries for many drugs, especially brand name drugs, but the statement overgeneralizes across the entire global market. On April 23, 2026, during the same event, regarding the announced Regeneron and Most Favored Nation pricing deal, President Trump stated, 17 of the world's largest pharmaceutical companies, representing 80% of the branded drug market, have agreed to sell their drugs at the lowest price anywhere in the world. This claim is misleading. Public reporting supports the existence of a 17-company framework and reports a similar branded market figure, but the claim overstates certainty by implying global lowest prices across the covered drug market without fully disclosed enforceable terms. On April 23, 2026, during the same event, regarding broader drug pricing reductions beyond a weight loss drug example, President Trump stated, "This is true of all. This is the weight loss drug, but this is true with all drugs." This claim is misleading. A pricing example for one drug or drug class does not establish that the same price pattern applies to all prescription drugs. On April 23, 2026, during the same event, regarding future pharmaceutical company participation in TrumpRX.gov, President Trump stated, "We will have every company involved." This claim is misleading. Available evidence confirms participation by a group of companies, but the statement overstates certainty by suggesting universal participation. On April 23, 2026, during the same event, regarding pharmaceutical companies' reaction to TrumpRX.gov, President Trump stated, "These pharmaceutical companies said they never saw anything like this." This claim is misleading. The statement presents a broad industry reaction without identifying the companies, speakers, or whether the reaction is representative. On April 23, 2026, during the same event, regarding artificial intelligence competition, President Trump stated, "We're leading China. We're leading everybody." This claim is misleading. The statement is broad and does not define the AI metric being measured, such as research, deployment, chips, investment, or model performance. On April 23, 2026, during the same event, regarding semiconductor manufacturing, President Trump stated, "All the chip companies are coming back." This claim is misleading. Available evidence supports some U.S. semiconductor investments, but the word all overstates the scope. On April 23, 2026, during the same event, regarding the U.S. chip market, President Trump stated, "I think we are close to 50% of the chip market." This claim is misleading. The statement does not define whether it refers to design, fabrication, advanced nodes, memory, demand, or revenue. On April 23, 2026, during the same event, regarding total investment claimed to be coming into the United States under his administration, President Trump stated, "There's never been anything like what we have done." This claim is misleading. The statement is an absolute comparison without a defined investment category or verified historical comparison. On April 23, 2026, during the same event, regarding his claimed lower-cost repair approach for the Lincoln Memorial Reflecting Pool, President Trump stated, "This is a much better job for much less money." This claim is misleading. Available evidence may support a lower-cost approach, but the better job claim requires technical comparison, durability analysis, and life cycle cost evidence. On April 23, 2026, during the same event, regarding his comparison between the reflecting pool repair approach he described and the prior higher-cost renovation approach, President Trump stated, "You get a better product than he could have ever done the other way." This claim is misleading. The statement compares two approaches without verifiable technical analysis. On April 23, 2026, during the same event, regarding public safety conditions in Washington, D.C., near the White House and surrounding areas, President Trump stated, "There is almost no crime." This claim is misleading. Official D.C. police data shows crime was down year-to-date in several categories, but it does not support the absolute characterization that there is almost no crime. On April 23, 2026, during the same event, regarding crime in Washington, D.C., President Trump stated, "We have it down from tremendously high, one of the worst in the country." This claim is misleading. Official D.C. data shows declines in several categories, but the statement lacks the specific baseline and national comparison needed to support the full claim. On April 23, 2026, during the same event, regarding oil exports from the United States, President Trump stated, "Ships coming from all over the world to get oil from the United States." This claim is misleading. The United States exports oil, but the statement lacks data on volume, destination, time frame, and whether the activity is unusual or connected to the event being discussed. On April 23, 2026, during the same event, regarding Iran's oil infrastructure under pressure from the reported blockade, President Trump stated, "Their whole oil infrastructure is going to explode." This claim is misleading. The statement describes an extreme projected outcome without verified technical evidence that such an outcome was imminent. On April 23, 2026, during the same event, regarding recovery from possible damage or disruption to Iran's oil infrastructure, President Trump stated, "You can recover 40, 50, 60%, but they have a matter of days until that takes place." This claim is misleading. The statement gives specific recovery percentages and timing without a verifiable technical basis. As for supported, 14 claims were identified. On April 23, 2026, during the White House Healthcare Affordability event regarding Regeneron and prescription drug pricing, President Trump stated, "Regeneron agreed to lower their prescription prices." This claim is supported. Public reporting and White House materials confirm a Regeneron pricing agreement. On April 23, 2026, during the same event, regarding Regeneron's cholesterol medication, Praluent, President Trump stated, "It will come down from $537. This claim is supported. White House materials and reporting confirm Praluent's listed reduction from $537 to $225 through TrumpRX. On April 23, 2026, during the same event, regarding FDA approval of Regeneron's gene therapy, President Trump stated, "Today, I'm also announcing that the FDA has approved a new drug from them, a gene therapy curing a rare disease that causes deafness." This claim is supported with context. FDA approval of Regeneron's otarmeni gene therapy for genetic hearing loss was confirmed, though the treatment applies to a rare genetic form of hearing loss rather than all deafness. On April 23, 2026, during the same event, regarding Regeneron providing the hearing loss gene therapy free in the United States, President Trump stated, "Regeneron will give this away for free for a period of time, for free." This claim is supported. Regeneron announced otarmeni would be provided free in the United States. On April 23, 2026, during the same event, regarding gene therapy cost, President Trump stated, "It can cost millions of dollars." This claim is supported in context. Some gene therapies are priced in the millions, making the general cost statement supportable. On April 23, 2026, during the same event, regarding ownership of the TrumpRX.gov website, President Trump stated, "The government owns it. I don't own it." This claim is supported. TrumpRX.gov is presented as a government site. On April 23, 2026, during the same event, regarding the Lincoln Memorial Reflecting Pool, President Trump stated, "That's where Martin Luther King gave his great speech." This claim is supported. Martin Luther King Jr. delivered the "I Have a Dream" speech at the Lincoln Memorial during the 1963 March on Washington. On April 23, 2026, during the same event, regarding the Lincoln Memorial Reflecting Pool, President Trump stated, "It was built in 1922. This claim is supported. Within construction timeline context, the reflecting pool was started in 1922 and completed in 1923. On April 23, 2026, during the same event regarding the Lincoln Memorial Reflecting Pool, President Trump stated, "It's more than 2,000 feet long. This claim is supported. The reflecting pool is commonly documented as more than 2,000 feet long. On April 23, 2026, during the same event regarding the Lincoln Memorial Reflecting Pool, President Trump stated, "It's 167 feet wide. This claim is supported. The stated width aligns with commonly reported dimensions. On April 23, 2026, during the same event regarding the Lincoln Memorial Reflecting Pool during repairs, President Trump stated, "Right now it's got no water in it." This claim is supported by the visual and event context showing the pool drained during repair discussion. On April 23, 2026, on Truth Social, regarding a diplomatic meeting in the Oval Office, President Trump stated, "Met today with high-ranking representatives of Israel and Lebanon in the Oval Office." This claim is supported. The meeting is reflected in his direct statement and surrounding official context. On April 23, 2026, on Truth Social, regarding a December executive order on medical marijuana and CBD research, President Trump stated, "In December, I signed a very important executive order calling for research and innovation for hemp-derived CBD. This claim is supported. The December 18, 2025 executive order titled Increasing Medical Marijuana and Cannabidiol Research confirms the substance of the claim." On April 23, 2026, on Truth Social, regarding a meeting about Los Angeles fire recovery, President Trump stated, "It was my great honor to meet with the Mayor of Los Angeles, Karen Bass, 5th District Supervisor Catherine Barger, and the Supervisor's Chief of Staff, Anna Moradian." This claim is supported by the post's accompanying image and meeting context. This brings today's totals to 2 false, 39 unsupported, 17 misleading, and 14 supported. The cumulative totals are updated and reflected on the scorecard. This review is based on direct quotes from President Donald J. Trump, sourced from Truth Social, other major social media platforms, press conferences, interviews, official White House releases, transcripts, and other public statements. This review excludes intermediaries, representatives, news outlet personalities, and secondhand interpretations. The words matter. The truth matters. The history matters.